It's different than I would think most administrators. I think that in mental health, intellectual disabilities, and developmental disabilities, we actually have 3 units within one department. Early intervention is developmental disabilities for children 0 to 3 that have a delay, 25% delay. Usually those children do receive treatment or services to train the families to move forward. And a lot of those kids graduate. They don't come into our theater later. Some do. Then we have mental health, and that's for people that have severe persistent mental illness. And then the third piece is the ID. The thing that's unique about our office is with each unit comes different regulations, funding streams. You could have actually 4 funding streams for one department. So it is quite a challenge to try to sort that out. You have to, I think the ticket is to have good staff around you, people that are really versed in what they're doing and be able to go off their gut and also be able to understand the needs of your community. Basically, it's a statewide association under the auspices of CCAP, which is the County Commissioners Association. So my bosses, the commissioners, have their own association, and we are under that. We're under that umbrella. They offer a wide array of conversations, of regulations, legislation to each county. And what's really unique in Pennsylvania has so many counties. We have like 67 counties, and I think there are 46 that basically have administrators because there's some counties that have joiners. That there's maybe 3 counties in one, bundled in. So administrators from far out in the western part of the state, they have different challenges than we do. PACA does offer us a lot of information from other areas so we can see and share information back and forth. When you say facilities, that's almost like a bad word in ID and MH. We try to keep people, we've worked real hard, especially in Chester County and throughout Pennsylvania, is moving people out of state institutions into the community. But most of our services are out in the community, and we have contracts with providers to provide that service. And like any other service, it is monitored heavily by the county because they rely on our funding. I have to sign those contracts for them to provide that service. So I have a large network of providers that I depend on. They do a great job, and that's how that works. It's not like one little facility. Opportunity that anyone would have to do direct care, work directly with the population is a benefit. Of course, any training or any education you get, psychology, basic psychiatry, anything on medications, neuroleptics, psychotropics, basic educational, but I think your real learning gauge comes from your education, by not only your education, but your grounding is on you understanding the folks that have the disability. I'm a real strong believer in that because I've worked 37 years in the county, and of those first 16 or 17, I worked direct care for youth that were in detention centers and troubled youth with mental health. The most information you can get from hands-on experience is probably the most valuable. But there is all the personnel issues, there's all the management issues, there's fiscal oversight, any kind of training in fiscal, any kind of training on contracts, any kind of training on legalese as far as what your requirements are, understanding regulations, trying to even understand the changes that go on in the state. You learn every day. So if you ever think you're an expert in it, you're not in the right field. I think the biggest thing you need for this job, in my opinion, is you have to have compassion and you have to be passionate about it. You've got to care about folks. And I tell my guys all the time that I work with, I said, we're a system that is dependent on our community. He cannot survive unless we make sure our community is safe and the folks we serve are safe. So we have to ask ourselves, is the service we're providing good enough that would be acceptable for my mother, my father, my sister, my brother?